Welcome back, everybody, to the deep dive. Ready for another deep dive?
Always.
Today, we're going deep into the world of fungal and protozoal diseases.
Hence a little intimidating, maybe.
Well, it might sound like we're prepping for a medical school exam, but trust me, we're going to break down these terms in a way that's easy to understand.
And even fun, hopefully.
Right. Plus, knowing this stuff can be super helpful, especially if you or someone you know has a weakened immune system.
Absolutely. These individuals are particularly vulnerable to these types of infections, so understanding them is crucial.
Let's start with blastomycosis, which, okay, that name sounds a bit like a sci-fi monster.
It does have a certain ring to it, doesn't it? But really, the name actually gives us clues about what it is. Blasto refers to budding yeast, those tiny single-celled fungi.
Ah, okay.
And mycosis, that just signals a fungal infection. So basically, blastomycosis is an infection caused by, well, there's a fungus for that, blastomyces dermatitis.
Blastomyces dermatitis. I'm already feeling smarter. So where does this fungus hang out?
Well, it loves the good life. Moist soil, particularly where there's a lot of decaying stuff, leaves, wood, that sort of thing.
So like a compost heap.
Exactly. And here's a fascinating tidbit. It often shares this cozy environment with another fungus called histoplasma capsulatum.
We'll have to get to that one later.
Yeah.
But right now, how do we even get infected with blastomyces dermatitis?
Through its spores. These are like microscopic seeds released by the fungus.
So tiny you probably wouldn't even see them.
Exactly. We inhale them, they settle in our lungs, and then the trouble begins.
And what kind of trouble are we talking about?
Well, initially, you might experience symptoms that mimic pneumonia. Fever, cough, chest pain, the usual suspects.
So you might not even realize it's something more unusual.
Right. But here's where things can get tricky. Blastomycosis can spread or disseminate, as we say in the medical world.
Disseminate, meaning?
Meaning it travels through the bloodstream or lymphatic system to other parts of the body.
Oh, no.
And it can affect a whole range of organs, skin, bones, even the prostate.
Wow, didn't see that coming.
In some cases, it can even reach the lining of the brain and mouth.
Okay, now I'm officially worried.
And here's another thing to watch out for. In the mouth, blastomycosis can cause these weird ulcers. The edges roll inward, almost like...
Like what?
Well, they can sometimes look similar to a type of oral cancer.
Yikes, that's scary.
Yeah.
So how do doctors figure out if someone has blastomycosis, especially if it can mimic so many other things?
They'll take a tissue sample and put it under the microscope.
Looking for clues.
Exactly. They're looking for those blastomyces yeasts. And they might also try to grow the fungus in a lab using a special medium that it likes to grow on.
Like a fungal petri dish.
You got it. Once they confirm it's blastomycosis, they can start treatment.
So what's the treatment plan?
For mild cases, they typically use an antifungal medication called itraconazole. But if things are more serious or the infection has spread...
They call in the big guns.
Pretty much. They'll use a more powerful antifungal called amphotericin B. It's a bit of a heavy hitter in the antifungal world.
Amphotericin B, got it. But for now, let's move on to a different beast. This one's got a really long name, paracoccidioidomycosis.
Try saying that 3 times fast.
I think I'd trip over my tongue.
It is a mouthful, isn't it?
Yeah.
It's caused by a fungus called, brace yourself, Paracoccidioides brasiliensis. And here's a hint. It's particularly common in South America.
Okay, so if I'm planning a trip to Brazil, I need to watch out for this one. What's so unique about paracoccidioidomycosis?
The mouth ulcers, they have this really unusual mulberry-like appearance.
Mulberry-like. Now, that's a description I've never heard before. Where do these ulcers usually show up?
They tend to appear on the alveolar mucosa, which is the tissue surrounding your teeth, and on the gums and the palate.
So basically anywhere in the mouth.
Pretty much. And if you see anything resembling a mulberry in there, it's definitely a sign to see your dentist or Dr. Pronto.
Noted. So how do they figure out if it's paracoccidioidomycosis? And what's the treatment like?
For diagnosis, it's similar to blastomycosis. Microscope time. They're looking for those multiple budding yeasts.
Those are really the smoking guns.
Exactly. They might also try to grow cultures, but this particular fungus is a bit of a slow poke in the lab.
Taking its sweet time.
Exactly. As for treatment, milder cases are usually treated with a combo of trimethoprim and sulfamethoxazole.
2 for the price of 1.
You could say that. But for the tougher cases, guess who makes a comeback?
Amphotericin B.
You got it. Our trusty antifungal superhero.
Always saving the day. So what's next on our fungal hit list?
How about coccidioidomycosis? or as it's more commonly known, valley fever.
Valley fever, huh?
Yeah, it's caused by either coccidioidomycosis or C. posidoceae, and you typically find it in the sunny desert regions of the southwestern United States.
So those beautiful desert landscapes come with a hidden risk. What should people know about valley fever?
Well, a good chunk of people, about 40% of those infected, actually experience symptoms that feel a lot like the flu, along with some lung issues.
Not fun.
No, but it can get worse. The chronic progressive form of valley fever that can mimic tuberculosis, just like blastomycosis.
So those initial flu-like symptoms could be deceiving.
Exactly. And when it spreads, things can get really serious. To the skin, often causing nodules and plaques, and in some cases, ulcers can develop in the mouth.
It seems like early detection is really key with these fungal infections.
Absolutely. How do they diagnose coccidioidomycosis?
Let me guess, microscope time again?
You're getting good at this. Yep, culture or a biopsy to see those characteristic fungal features.
And the treatment. Antifungals, right, with maybe a guest appearance by amphotericin B for the tough case.
You're on fire today. Fluconazole or itraconazole are usually the first line of defense, but for severe or disseminated infections.
Amphotericin B swoops in to save the day.
Precisely. Speaking of tricky infections, let's talk about cryptococcosis. This one's caused by either Cryptococcus neoformans or C. gaudii.
Cryptococcosis. I feel like I've heard that one before. What makes it stand out from the crowd?
It's a major concern for people with weakened immune systems because, well, their bodies have a harder time fighting it off.
Makes sense.
It often starts in the lungs, but here's the thing. It might not even cause noticeable symptoms at first.
Sneaky. So what happens?
Well, sometimes it feels like a mild cold, but the most common form of disseminated cryptococcosis, that's meningitis.
Meningitis, that sounds serious.
It is. It's an inflammation of the membranes surrounding the brain and spinal cord. Headaches, fever, stiff neck. Those are the classic symptoms.
Not good. So how do they even diagnose something like cryptococcosis, especially if those early signs are so subtle?
They test your blood or cerebrospinal fluid for a specific antigen.
Antigen.
It's like a little red flag that the Cryptococcus fungus is present.
Okay. And treatment? More antifungals, I presume?
You know it. For meningitis, they typically use a combination of, drumroll please, amphotericin B,
Our star player.
and another antifungal called flucytosine. For less severe cases, they might stick with fluconazole or itraconazole.
Right. Those seem to be the workhorses in the antifungal world. Okay, ready for the next one? What about mucormycosis? That one sounds like a real mouthful.
It does have a certain gravitas, doesn't it? It's also known as zygomycosis, and it's definitely one you don't want to encounter. This one is caused by a group of fungi.
A whole gang of them.
Exactly,
Okay.
including the notorious mucor and rhizopus. And here's the thing. It primarily affects folks with weakened immune systems.
So those with diabetes maybe, or who are undergoing chemotherapy.
Got it. People taking iron chelating medications are also at higher risk.
Iron chelating. That's a new one.
They're often used to treat iron overload, but they can also make you more susceptible to this particular infection.
Interesting. So how does this mucormycosis or zygomycosis usually show up?
Well, one of the most concerning forms is rhinocerebral mucormycosis.
Rhinocerebral, that sounds complicated.
It means it affects the sinuses and it can spread to the brain.
Okay, now that's officially scary.
It can be pretty aggressive. We're talking facial swelling, pain, nasal discharge, and even necrotic ulcers.
Necrotic ulcers. Ugh, we've talked about ulcers, but what does necrotic mean?
It essentially means the tissue has died. So necrotic ulcers are open sores where the tissue has started to die off. Not a pretty picture.
Definitely not. Does mucormycosis ever affect the mouth?
Unfortunately, yes. If it gets into the maxillary sinus, which is in your cheekbone area, it can cause ulcers on the roof of the mouth and even black necrotic tissue.
Okay, that's enough internet for me today. I'm going to go brush my teeth now.
Good idea.
But seriously, how do doctors even diagnose something like that? And how do they treat it?
Diagnosis usually involves examining a tissue sample under a microscope, looking for those telltale fungal structures. Treatment for this one is pretty aggressive. A combination of surgically removing the infected tissue, which is called a debridement, and
Amphotericin B.
you know it. It's a powerful antifungal that often comes into play when we're dealing with serious infections.
Right. All right, let's wrap up our fungal foray with aspergillosis. What can you tell me about that one?
Aspergillosis is caused by Aspergillus flavus and Aspergillus fumigatus. And guess what? You're breathing these fungi in all the time.
All the time. Even right now.
Probably. Especially if you're doing things like construction or remodeling, all that dust, It's a fungal playground.
So those N95 masks, they're not just for COVID anymore.
Exactly. Now, there are different types of aspergillosis. The non-invasive types are usually not as serious.
Like a mild allergy or something?
Yeah, they might cause allergic sinusitis or even a fungal ball in the sinuses.
A fungal bowl.
Sounds gross, but it's usually treatable.
Okay, good to know.
But then there's the invasive form. That one's a whole different story.
And I bet it's especially dangerous for folks with weakened immune systems.
You're catching on. Invasive aspergillosis can lead to, you guessed it, necrotic ulcers. And for those with weakened immunity, it can spread throughout the body.
So we've got to be extra vigilant. How do they diagnose and treat invasive aspergillosis?
Diagnosis usually involves a culture and looking for the fungal structures, called hyphae, under a microscope. Treatment typically involves an antifungal medication called voriconazole.
Voriconazole, another one for the antifungal arsenal.
Exactly. For localized infections, they might surgically remove the affected tissue.
Okay, so we've covered a ton of ground in the fungal world, but our deep dive doesn't stop there. Next, we're shifting gears to protozoal diseases.
The fun never ends.
And we'll start with one that might sound familiar. Toxoplasmosis. What's the deal with this one?
This one's caused by a microscopic parasite called Toxoplasma gondii. And here's a fun fact. Cats play a key role in its life cycle.
Cats. So those adorable furballs might have a dark secret.
Well, maybe not dark, but cats are the definitive hosts for Toxoplasma gondii, meaning they're essential for its reproduction.
So how do we humans get infected with this Toxoplasma gondii?
A couple of ways, actually. One is by accidentally ingesting the parasite's eggs. They're called oocysts, and they're shed in cat feces.
So that's why we should always wash our hands after cleaning the litter box.
Exactly. You can also get infected by gardening in contaminated soil, or by eating undercooked meat.
So good hygiene and proper cooking are key. What about the symptoms?
The good news is that most healthy people experience either no symptoms or just mild flu-like symptoms.
A sigh of relief.
However, for people with weakened immune systems and for babies infected in the womb, it can be much more serious.
So pregnant women really need to be careful about toxoplasmosis.
Absolutely. Avoid cleaning litter boxes and make sure all meat is cooked thoroughly. No rare steaks.
So how do doctors even know if someone has toxoplasmosis?
They'll look for a rise in specific antibodies in your blood. It's a sign that your body is fighting the infection.
In treatment? Antibiotics, maybe?
Not quite. For toxoplasmosis, they actually use a combo of medications called sulfadiazine and pyrimethamine.
Got it. Prevention is definitely the best strategy, especially for pregnant women. All right, let's move on to our final protozoal disease for today's deep dive. What about leishmaniasis? What's that one all about?
Leishmaniasis is a fascinating but potentially serious disease spread by the bite of infected sandflies.
Sandflies. Oh no, those sound even worse than mosquitoes.
They can be a nuisance, for sure. And unfortunately, they can transmit the parasite that causes leishmaniasis, which is called leishmania.
And are there different types of leishmaniasis?
Yes, several. There's the cutaneous form, which affects the skin. It can cause these papules or ulcers that
look like what?
Well, some people describe them as volcano-like.
Volcano-like ulcers. I'm adding sandflies to my creatures to avoid list.
Probably a good idea. Then there's the mucocutaneous form. This one attacks the mucous membranes.
So we're talking nose, mouth, throat.
Exactly. It can cause ulcerative plaques in those areas. And finally, there's the visceral form, which is the most severe. It's also known as Kala-Azar.
Kala-Azar. That sounds ominous. What happens with visceral leishmaniasis?
It affects the internal organs, leading to an enlarged spleen and liver, fever, and significant weight loss.
This one sounds like it packs a punch. So how do doctors figure out if someone has leishmaniasis?
They might examine cells or tissues under a microscope, or they might use a technique called PCR.
PCR, that's the same technique they use for COVID testing, right?
You got it. It's a really powerful tool that allows them to detect the parasite's DNA.
Cool. What about treatment for leishmaniasis?
It really depends on the type and how severe it is. They might use medications like liposomal amphotericin B or pentavalent antimonials.
More tongue twisters.
It does take some practice to say those names, but they can be lifesavers.
We've really explored a whole world of fungal and protozoal diseases today. It's amazing how diverse and complex these microscopic organisms can be.
It is, isn't it? They're all around us all the time, but we often don't even realize it.
And it's fascinating how they can cause such a wide range of symptoms, from mild flu-like symptoms to life-threatening complications.
Absolutely. It just goes to show that even though we can't see them, these microorganisms can have a huge impact on our health.
Well, thanks for guiding me through this microscopic jungle. It's been a fascinating deep dive. But we've only just scratched the surface, haven't we?
We've got a lot more to explore. Stay tuned for part 2 of our deep dive, where we'll unpack even more fascinating medical terms and delve into the world of histopathology.
Can't wait.